multiple sclerosis or MS and systemic lupus erythematosus or SLE share a lot more common than just a butterfly symbol. Well, if we put it quite simply, in both the diseases, the immune system of the body mistakenly attacks the tissues. But why is this butterfly symbol so significant? Well, we can get the answer by exploring the origin of the names of these diseases. Well, the name multiple sclerosis refers to the numerous glial scars or sclera, which are essentially plaques or lesions that develop on the white matter of the brain and the spinal cord. Now, the butterfly shape shows up very prominently in the MRI of MS patients as a result of these lesions. And in SLE patients, the butterfly symbolizes the characteristic butterfly rash that we can observe on the face of these patients. Now, SLE is also commonly referred to as lupus. And the word lupus comes from the Latin word for wolf. Well, it was used to describe the erosive facial lesions that were reminiscent of a wolf's bite. And the word erythematosus comes from the Greek word erythros, meaning red, and it refers to the reddish color of the circular-shaped facial lesion. So the name itself is telling you that these patients will have a characteristic red-colored rashes on their faces. Well, it's quite unlikely for a patient to have both MS and lupus, but sometimes MS patients are incorrectly diagnosed with having lupus because these diseases share quite common symptoms. Well, these commonly are chronic autoimmune diseases, and they affect mostly the people of a similar age group. That is, they're quite common amongst younger women. And these patients have a genetic predisposition as these appear to run in families. And both are relapsing remitting diseases. That means that their symptoms may worsen or improve at times. And they often include loss of movement, memory loss, and pain. So our confusion amongst these two diseases is not unjustified. Well, how should we deal with this confusion? So in this video, I will be sharing the distinctive features of both of these conditions. And I hope after watching this, you will be able to better differentiate between these two.